Hello friends. So today we are with Miss Nivedita from Minneapolis, and she came here for bariatric surgery, and we did a bariatric surgery 2 months back. So let's have a chat or talk to her about the surgery, about the experience of the surgery, and how she is recovering now. And uh, you're welcome, Nivedita.
Thank you, Dr. Saggu.
So, my viewers and I, of course, we want to know that how you took a decision for the bariatric surgery, and what was the surgery, how it was done, please.
Absolutely, absolutely. Well, thank you for the opportunity to speak to everyone, Dr. Saggu. I'm more than happy to share my experience. So when I came here for bariatric surgery, the decision making for me was actually quite immediate. I had no plans, honestly, to do bariatric surgery when I first came to India about 3 or 4 months back. But it so happens that I was in Gwalior and Apollo Spectra in Gwalior is available. It's within sort of run by in the family.
Yeah. So, I would like to tell you that even in Gwalior Apollo Spectra also the bariatric surgery is available, and we are doing the same quality of surgery over there, which we are doing in Delhi also. So we have an opportunity for all the people from the Gwalior, so they can go to Apollo Spectra Gwalior for the bariatric surgery.
Anji, and so my decision actually happened because of the fact that I had access to the Apollo Spectra Hospital in Gwalior, where bariatric surgery was done by Dr. Saggu. I had access to Dr. Saggu. I think that for me, that was a main decision making factor, because I had heard so much about Dr. Saggu and the successes he'd had and his background and his education and expertise. And the fact that my uncle and aunt who run Apollo Spectra in Gwalior, they had highly recommended Dr. Saggu. So after that, there was just no question left in my mind, and I took the jump.
Okay. So, what was the problem which forced you to take a decision for the bariatric surgeries?
So for me, I would say that it was twofold. One was that the excess weight that I had, that I'd been carrying for about 15 years or so, was definitely hampering my mobility and the kind of lifestyle that I wanted to have.
Daily activity.
Daily activity. Yeah. And I was trying to lose weight. In the past couple of years, I had successfully lost about 10-15 kilos. But I always had the issue that it would come back.
Yeah.
You know,
so it actually happens when you do a dieting and when you do exercises with the high BMI, right? If you have a low BMI, then with the exercise and diet, you can lose weight, and that is, recommended.
Exactly.
But if your BMI is more than 32.5, then I think bariatric surgery is the only answer. If you do dieting and exercises, then maybe you will lose, and then that will come back with the double weight.
Yeah, that's precisely, I think, that worked with, was the case with me. And then there were two medical situations also. I have to say that I was diagnosed with high blood sugar, so I was a diabetic. I was having medication for diabetes. And I actually broke a ligament in my knee, which was really worsening the condition of not only the injured knee, but also the other knee, because I was trying to compensate and kind of move around with a brace. So it was these factors that really I wanted to have a way that I could not only lose the weight, but keep it off. I wanted a mechanism, and I wanted something that was safe, relatively safe and well tried.
Yeah, we can say the obesity is a mother cause for so many things. Like she was having a diabetes, she was having stress on the knees, you were having snoring, I think snoring also.
Yeah, people told me that I used to snore.
Yeah, and the mobility was not very good. You were not able to walk a long distance, right? So all these conditions, some other patients also, some patients have infertility, some other patients, they have other problems because of the obesity. So obesity is a root cause of all these conditions. So if we can treat the obesity, then we can remove all the diseases which you have, like diabetes she has. So now I would like to ask you, what surgery was done?
Yeah, for me, I got sleeve gastrectomy done. Mini gastric bypass was an option, and I have to say that when I consulted with Dr. Saggu, he was very, very clear, given my condition. He explained both all the techniques that are available, and you know, I was gravitating more towards sleeve gastrectomy, which after Dr. Saggu looked at my medical condition, he felt comfortable in proceeding forward with that. So we went for that.
Yeah. And how was the experience of your surgery? I mean, for the hospital, how many days you were in the hospital, and after surgery, how many days you started your daily activities, your liquid intake and all?
Yeah. So my operation happened on 18th of November 2018, and I was hospitalized on the 17th. So I entered a day before, and you know, I was prepared.
Yeah, just to stabilize your sugar levels and all.
Sugar levels, and there's certain kind of diets you give, you know, like liquids and stuff to cleanse the system. All of that happened. Surgery for me, knowing that Dr. Saggu was doing, I was like literally, okay, I'm ready, gonna go for it. And I think the surgery itself went very smoothly from what I've been told, what Dr. Saggu and everyone told me. It was relatively short, about an hour and a half, something like that. With you know, laparoscopy.
Yeah, it was a laparoscopic surgery.
Yeah.
Minimal access surgery.
Yeah.
And usually it takes around 45 minutes to 1 hour.
Yeah.
For surgery, and then 1 hour for anesthesia.
Yeah, so you know, I remember the effects of the anesthesia because I was just waking up and you know, all of that. But and then typically Dr. Saggu would have his patients move the very same day, but I think Dr. Saggu had to leave a bit early that day.
Yeah, I actually left for the Delhi, so that's why they make her mobile the next day.
So I got some extra rest because but then I did start moving around the next day, and you know, they kept me without water for about, I think, 24 hours.
Yeah.
And after that, you know, all the fluids and water, that started for me.
So one quick question for you. Mm-hmm. Was your surgery painful?
Well, I felt nothing. I mean, you know, I felt nothing.
Because this is the common question with all the viewers, they want to, ask. Is it painful?
Yeah. Well, and I'm glad you're asking me this because I had exactly the same kinds of questions when I first, you know, when I consulted with Dr. Saggu. So I would say that for me, of course, while you're getting the surgery done and the anesthesia, you don't feel anything, you're kind of just under the effect. After the surgery, for me, I felt a little bit, I gotta be honest, a little bit of the pain, but that was mainly because there was a stitch inside that Dr. Saggu decided to give me. It isn't given to everyone. The holes that were made for the laparoscopy, those were honestly not painful at all. So there was only one area that pained for a few days, but with medication, it was well under control. And you know, I for me personally, the biggest thing was that I had access to Dr. Saggu. I could talk to him, tell him that, hey, this is what's going on, and he would get the medication upped as needed to get it all under control. So, you know, if I were to look back and think about those 2-3 days of somewhat of pain and compare it with where I'm at, with the advantages I've gained, I mean, that seems so negligible in comparison to the benefits that I've gained.
So we always compare that the benefits you take from the surgery and the problems, I mean, small pain and all these things you have with the surgery. So definitely the benefits are more. So now come to the benefits. Can you count your benefits, or is incountable improvements you had?
Well, I'll tell you, the fact that I feel great, to me, that is, how do you count that, right? You can't put a measure to that. So that's the number one. But you know, I'll try to give you maybe some more specific ones that I'm feeling, just to give you a sense. So I think one is just feeling great, just feeling like, you know, I have more control over just, you know, just how I'm looking, how I'm feeling, what my health is like. I stopped taking medication for diabetes from the day I was operated. So just the insulin in my body apparently was enough at that point in time to take care of the diabetes. So no medication for over 2 months. I'm diabetes free. To me, That's a
Oh,
huge,
yeah.
probably the biggest win.
Definitely, that is a great
Biggest win for me.
So I will ask you, since how many years you are taking the diabetic medicine?
I started in 2014.
14.
Yeah.
So I think for 5 years, for 4
4
years.
years
4
for
years.
sure. About 4
And
years.
did you take diabetic medicine after surgery 4 days?
No, I stopped the very day.
So she was taking diabetic medicine for 4.5 years, but after the surgery, even she has not taken for a single day.
Not for a single day. And, I get my blood sugar checked randomly just to see, how I'm doing. And I'm amazed. Even with the medication before, I didn't get the same blood sugar levels that I'm getting now.
Yeah.
And this is random.
Yeah.
So
Today
that
is random 125.
125 random.
Yeah.
2 days back it was 104 random.
Yeah.
So,
That's the great. I mean, with the medication, I think your random was 180 at that time, 179.
Yeah, something
so
like
she
that.
was saying something before surgery.
So I'd say that the fact that my knees are, I'm moving more despite some additional injury I had. I slipped about 20 days back. I'm able to move more. I'm walking about 30 to 40, 45 minutes a day. Wasn't able to move as much, so the weight gone, I'm able to move more. Like I said, it might sound like a small thing, but it's a huge thing to me that I can actually buy clothes from boutiques. They have my size now. And within 15 days, Dr.
So you
Saggu,
don't have to give calls to your tailor every time. So
No.
you have to make like this.
No.
You can take the ready-made stuff.
I can, and I can get the latest styles, right?
Yeah, that's
So,
great.
which is important. So,
More fashionable now.
I feel that. I feel great about I'm taking just so many clothes with me back to US.
You can try your clothes. I mean, 100 clothes in one time.
Yeah.
You just go and just wear it.
Yeah.
Otherwise, you have to make it stitched.
Exactly.
Yeah.
Exactly. So small thing, but a big thing for me. I feel great about, and I should say that the fact that people around me, my family members, my friends, Dr. Saggu, they're able to see the change in me and they remark every time. And that feels wonderful to me, So it's an overall feeling of just the added confidence, health, how I'm feeling about myself. One more important thing, if I can say, Dr. Saggu, I feel that's been very important for me, is just how my choices have changed in terms of what I'm eating, what I'm drinking.
Eating pattern.
My eating
pattern has changed.
the types of foods,
Yeah.
how the quantity I'm eating. Now, of course, once with bariatric surgery, you can't overstuff. There's a certain, you feel satiety much sooner. But even after doing that, the kinds of, I can go back and start eating, after 2 hours, go back and eat bread or whatever. But I don't feel like eating that. Something's changed in me. I'm making more choices like soups and fruits and nuts. I feel like choosing those things more.
So whatever we teach to our children, like they have to take small meals, frequent meals, they have to chew it properly, you have to take small sips. So everything now she has learned that how to eat and what to eat. हिंदी में कहते हैं ना कि क्या खाना है, कब खाना है, कितना खाना है और कब बंद करना है
और कितना चबाना है,
है।
Oh my God.
ये 5 चीजें जो हैं ये तो समझ में आ जाती हैं बैरिएट्रिक सर्जरी के बाद में। That's great.
बिल्कुल. So I mean कितना चबाना है इसमें मेहनत लगती है, क्योंकि भूल जाते हैं. पर बैरिएट्रिक के बाद द फैक्ट कि आप अच्छे से च्यू कर रहे हैं, अच्छे से आपका खाना डाइजेस्ट हो रहा है, ये आप अपने आप आपकी बॉडी आपको बताने लगती है कि आप उस थ्रेशोल्ड के बियॉन्ड या आप ढंग से नहीं खा रहे. तो ये मेरे को जैसे डॉक्टर सगु कह रहे हैं, मुझे सीखना पड़ा ऐसा लिटिल, जैसे बेबीज को सिखाना पड़ता है.
बिल्कुल. और एक बार जब आप सीख जाते हैं तो then your life is smooth, very smooth. So bariatric surgery is basically a steering of your life, which gives you the control of your life. You are all that easier, right? And how much you lost?
So मेरे roughly 2 months हो रहे हैं. 2 दिन बाद मेरे 2 months हो जाएंगे. I have lost 13 kilos.
That's great.
And honestly, 13 kilos is quite average. कई लोग 15-16 भी lose करते हैं. मेरे केस में क्या हुआ था, मेरे को इंजरी हो गई थी दिसंबर में, जिसकी वजह से मेरी मोबिलिटी और रिड्यूस हो गई थी.
So maybe the reason that you have lost 2-3 kgs less than the regular patients they lose.
I feel great. I'm very happy with my 13 kilos loss.
Yeah. And one personal question.
Hanji,
So the weight you are having today,
Hanji.
in the past, when did you had the same weight?
Oh,
I mean, today you are around 100.
Hanji.
So in the past, when you were 100 kgs?
100 kgs, मैं पता सोच रही थी इस बारे में, मेरे ख्याल से 1999 या 2000 में लास्ट था मेरा.
20 साल पहले जो वेट था, सर्जरी के 2 महीने बाद वही वेट आ गया. So that's great. That's great. So I mean, it was very nice talking to you, Nivedita, and I wish you all the best.
Thank you,
You
Dr.
recover well, you do well, lose weight, be happy, and have a smile always.
Thank you, Dr. Saggu. Thank you, friends. Of course, it's been a journey for me, and I would absolutely not be able to do it without Dr. Saggu. I have to say, not only is he a very skilled doctor in what he does, he's a wonderful human being. He cares for you.
Thank you so much.
And that's what matters.
Thank you. And do you have a quick message to our viewers who are obese and they are having diabetes? Should they go for bariatric surgery? I mean, what is the solution you think for diabetes and for obesity?
Yeah, I feel, from my experience, I would say that if you do your research and find the right doctor, and honestly, the right doctor is sitting right here in my eyes,
Thank you
okay?
so much.
And go for it, do your research, become comfortable in your decision. I'm not saying go in a rush or whatever, but when you have these kinds of life-limiting kind of conditions, I have asked myself, why did I wait this long?
Okay. So the quick you take the decision, quick you can change your life.
I feel that way. I really do.
Yeah. Thank you so much.
Thank you so much, and all the best to everyone. Thank you, Dr. Saggu.
Thank you.